Hey there, everyone. Welcome back to my YouTube channel. This is the ATM channel, All Things Menopause, brought to you by Miss Ball, your menopause specialist, sexologist, Black American lady doctor, Dr. Sonia Carruthers. All right, when I spoke last, I gave you definitions of perimenopause and of menopause. But what I didn't tell you is that female can experience menopause other ways as well. She can go through what we call chemical menopause, and maybe because of chemotherapy, radiation therapy, that makes the ovaries not operate anymore, or they fail altogether. And so she's like plunged into menopause because of that reason. Or a female may experience what we call surgical menopause. Surgical menopause is when the ovaries are removed. Okay, big question on your mind. I know you're probably saying, well, what about me? I had a hysterectomy, uterus is gone, ovaries are still there. How do I know if I'm in menopause? Average age is about age 52. You still have your ovaries, you will go through menopause naturally, because what happens is over time, the ovaries stop functioning. And 40s, 50s, early 50s, you may experience some of those perimenopausal symptoms like hot flashes, night sweats, vaginal dryness. We'll talk about that tonight. Brain fog, not able to think clearly anymore, skin changes, a lot of those body changes that we're going to get into as these videos progress on. So I told you tonight we'll talk about the genital and urinary system. We'll start with the genital system, specifically the vagina. So what happens in the vagina during menopause? Well, there are changes in the tissue, in the superficial tissue within the vaginal canal. The tissue becomes thin, it becomes pale, it becomes dry. So prior to menopause, the tissue within the vaginal canal it has a lot of folds in it. We call those folds rugae. Just like layers of folds, kind of like the palm of my hand, just like this. Nice folds. This tissue is, it's thicker, it's highly vascularized, which means it's red, it's pink in color, and it's highly moisturized. When menopause happens, this nice, thick, folded tissue becomes thin, dry, and pale. And that's what happens within the vagina. Because of that reason, many females experience what we call medically dyspareunia, or pain during intercourse. And that's what my research focused on, changes in desire and response from the female perspective and male perspective during menopause. What's happening, why we're having these changes, and why is my desire decreased. And what I found out is mostly the desire is decreased because a female is experiencing dryness and pain, and she doesn't want to experience it anymore. And if you're having those similar symptoms within the vaginal canal during intercourse, dryness, pain during intercourse, talk to your healthcare provider, because there's things that we can do to help mitigate those symptoms. You personally, there are items you can purchase over the counter. There are moisturizers. If you turn the box over, directions will say it's something you apply every 3 nights like clockwork. That's a vaginal moisturizer. And what it does, it adheres to the vaginal wall to keep the area moisturized all the time. And I also recommend usually using a lubricant as well, so that you don't experience the dryness and pain during intercourse. Disclaimer, this is for your knowledge. This is not medical advice. I do encourage you to go see your healthcare provider to ask him about, or ask her about options, medical options or prescriptions you can use to help eliminate, decrease, mitigate any signs and symptoms of dyspareunia, painful intercourse, dryness, irritation. If you have any questions, I'm giving you these videos so that you can be well informed. But if you have any questions for me, email me at askmissballmenopausedoctor@gmail.com, and I will spend Thursdays answering your questions, any questions you have related to the topic for the week. All right, that is my subject for tonight. Tomorrow, I'll get into more of the genital area. Today, I'll talk about the vagina. We're going to talk about the outer canal tomorrow, or the outer area tomorrow. And then on Wednesday, we'll talk about the urethra and the bladder itself. All right, guys, have a great night. Take care. Bye-bye.